Dr. Nirja Shah, MD of University of California, San Diego Health, shares a compelling case study on paraneoplastic cerebellar degeneration, PCD, unveiling bilateral breast cancer in our exclusive interview. Notable quotes from this interview. Quote, "What I learned from this case is that in a patient with subacute cerebellar degeneration, particularly women, it's important to consider sending out a paraneoplastic panel and looking for any underlying malignancy. We ended up scanning her to see if she had any underlying malignancy because anti-Yo antibodies are associated with both breast and gynecologic cancer, specifically ovarian cancer. I was really surprised to see that she had a divergent kind of receptor profile for her bilateral breast cancer. One breast had HER2-positive cancer, and the other breast was hormone receptor positive. I've really not seen much of that."
All right, so I had a case report on a 44-year-old patient with no significant past medical history. She came into the emergency department with a 10-day history of ataxia, clumsiness, and dizziness. She ended up getting a MRI brain, and that showed a cortical or subcortical flare hyperintensity in the left cerebellar hemisphere region. She was then admitted to the medicine service, underwent a lumbar puncture, which was significantly positive for anti-Yo antibodies, which are also known as Purkinje cell cytoplasmic antibodies. So with this anti-Yo finding in the CSF, we ended up scanning her, and the reason is because anti-Yo antibodies are associated with paraneoplastic cerebellar degeneration, which is when there's an immune response and the neuronal antigens in the cerebellum are attacked by these anti-Yo antibodies. So we ended up scanning her to see if she had any underlying malignancy because anti-Yo antibodies have an association with both breast and gynecologic cancers, specifically ovarian cancer. We ended up finding that she had a nodule in her left breast as well as another nodule in her right breast, and she was diagnosed with actually bilateral breast cancer with divergent receptor profiles. So what I've learned from this case is that in a patient with subacute cerebellar degeneration, particularly women, it's important to consider sending out a paraneoplastic panel and looking for any underlying malignancy. In this case, she ended up having breast cancer that was found only after an initial presentation of subacute cerebellar degeneration. So that's a little bit about my project.
Fantastic. Is there anything else that was striking about this? Was the outcome? Was there an outcome?
Yeah, so I think the most striking kind of case for me, and again, I'm a resident, so I'm still learning a lot about oncology, but I was really surprised to see that she had a divergent kind of receptor profile for her bilateral breast cancer. So one breast had HER2 positive cancer and the other breast was hormone receptor positive. I've really not seen much of that, so I found that to be very interesting. And another kind of interesting initial symptom manifestation of this cerebellar degeneration was also pretty astounding. And again, the differential is very wide in the beginning. Is it infectious? Is it the malignancy was very low in the differential initially until we did some further scanning and realized that she does have indeed breast cancer.